McClendon, CEO of Recover. And this is Erica Mizuta, CEO and Doctor of Physical Therapy for Recover. Today we're going to talk about ergonomic assessments. Before we get started, be sure to click the like and subscribe button at the bottom. All right, Erica, can you tell us what is an ergonomic assessment?
So an ergonomic assessment is where physical therapists will look at typically a computer workstation setup that a patient is using, but it could be something as simple as looking at how they're using their iPhone or their iPad, or even maybe how they're reading a book. And it doesn't necessarily have to be somebody that's still working. I see a lot of retired people that still use computers a lot that have ergonomic issues that they need to have looked at. So we get contacted sometimes by a company and we'll go in and we'll do a bunch of ergonomic assessments at one time, or it'll be done individually as a patient comes to therapy. And there's a lot of different things that we can do. We always are going to be looking at how their computer monitor, the height of it, how their chair fits them, what type of mouse they're using, what the position is. There's a lot of different equipment that we can prescribe in order to solve a patient's pain or issues and to make the ergonomic assessment or setup correct.
Okay, so it sounds like unless a company contacts you specifically to go and do the ergonomic assessment, you're going to be asking any patient that you evaluate a little bit more about their pain, where it's coming from, and if it's a red flag, they may need an ergonomic assessment, and you would be able to go from there and prescribe different things for them to get for their computer or their setup or their phone.
Yeah, correct. When you go to physical therapy, you should have a thorough interview with a therapist, including measurements, but also questions. So yeah, I ask patients, like, how much time are you on the computer? How much time are you on your phone? Do you spend a lot of time reading? It's interesting because a lot of people don't think that especially phones are a huge culprit, but they don't think they're on their phone that much until you go into the iPhone and you can see the screen time and then they're shocked. But yeah, so, basically finding out what positions cause them pain, and then we're trying to figure out when is the person in that position and what can we do to alleviate the pain in the position and make it better.
Okay, so Erica set up my desk, so it should be ergonomically sound. But with all this, you've told me to make sure that I take breaks away from my computer because I'm working for about 8 hours a day. So it's important for me to do a couple of stretches here and there and do some maybe foam rolling. So I wanted to talk a little bit more about that.
Yeah, that's definitely an important point because it doesn't matter how great your ergonomic assessment is. Your body was not meant to sit for 8 to 10 hours or be in the same position. So that's one thing I always talk about with my patients is, I give them exercises, different stretches, maybe different strengthening exercises to do. And, a lot of people, I think they're going to wake up in the morning, take 5 minutes, do their exercises, and they're going to be good. That's not how it actually works. So we kind of use those exercises like medicine throughout the day. So, if a person notices they're kind of coming forward or if they've been sitting for a little bit, I always tell people set a timer. So maybe after 45 minutes or so, they get up and they do a couple of stretches to correct that position. So yeah, they use those exercises and stretches throughout the day, kind of like their medicine, so that they don't have pain and to prevent those issues.
Okay. And can you talk a little bit more about what an ergonomic setup would look like, say for somebody that's at a computer?
Yeah, so the biggest thing that we look at usually first is going to be chair, the height of the chair, and is the chair getting the person's elbow in the correct position? Because our ideal is to have a 90-degree angle in the elbow when they're typing. So once you get that set up, then there's a whole bunch of other things that we look at, which includes like how high the computer monitor is, how close the monitor is, where the mouse is it too far away, is it close enough? Then some of these setups get more complex because I have patients that literally use 3 different monitors. So yeah, you kind of have to know like which one is the main monitor and which one are they using most often if there's 2. Because I see a lot of people that will sit at a monitor and then they turn their head this way to look at a different monitor and then they wonder why they have neck pain. Right. So yeah, so it kind of depends on the individual patient and what they need. But yeah, we go through all of those things. There's a lot of different equipment that you can use, and honestly, some of it is free. If I have a patient whose monitor is too low, you can put books underneath it to lift it up. You don't have to have anything fancy. So,
right.
There is nice things that are fancier, but there's also cheap ways to fix it too. So.
Yeah, so it doesn't take much to fix the issue.
Yeah, correct.
Well, this was great information today, Erica. Appreciate your time. Stay tuned for more videos from Recover.